Hello and welcome to another episode of Community Connections, airing on OROMIA11. I am your host, Anna Orr, and today we are talking with a community health worker about overall health. We're talking about a little bit about COVID and how you can prepare for what's coming this fall. Stay tuned. Latrice, thank you for joining me on this episode of Community Connections. Can you introduce yourself and your role with Broadway Family Medicine Clinic?
Yeah, my name is Latrice Van Buren Thompson. I'm the community health worker at Broadway Family Medicine. I've been there for 5 years, and that's what I do there.
Can you talk to me a little bit about the role as a community health worker? I'm familiar, but I'm sure other people, this may be the first time that they hear about the nature of this work.
Yeah. Well, I love talking about my work, actually, because I love being a community health worker. My role at Broadway as a community health worker, I like to see myself more as like the bridge between community and an individual and their overall well-being in the medical aspect. So that bridge, there's a lot of things that people encounter in between themselves and being overall well and their health care. And so, I am that bridge. So whether it's helping with the barriers that's keeping you from being focused on your health, which I go off our social determinants of health, the things that make us overall well. Do we have safe housing? Do we have the adequate education? Do we have food? Do we have transportation? Do we have the necessities that are going to create an overall well person? And so that's pretty much what I focus on in my role.
Okay. And then can you talk to me just a little bit about what the work of Broadway Family Medicine is like day to day?
Yeah, so Broadway Family Medicine is a full family practice clinic. So we see from pregnancy to end of life. So everything in between. Like I said, OB, pediatrics, geriatrics, but we also have addiction medicine there. We have sports medicine there. We have behavior health there. So you're gonna be seen for all your preventative care, for all your ailments, any diseases, your mental health. That's everything we do in the community. We serve North Minneapolis, but we have people that come from Wisconsin that are seen in our clinic. We do like primary care. We also do research. We do a lot of grant studies, a lot of projects, community partnerships, but the most part, and we're a residency clinic. I guess I should speak to that, that we're a residency clinic, so we see residents, first year, second year, and third year residents. It's funny because I did not know about Grey's Anatomy. I've never watched it before. So a lot of people understand residency. Yes. Even when I start talking about it, they're like, oh yeah, I watched Grey's Anatomy. Yes. It's like, oh, I've never watched an episode in my life. So I learned when I came here the operations of a residency clinic. So we have faculty, we have a staff of 19 faculty, and then we have 8 third years, 8 second years, and 8 first year residents that are finishing their last stint to become a full operating doctor on their own.
I think that's beautiful, and I think it's brilliant to share with viewers that this is taking place in North Minneapolis, in our very own backyard for a lot of us.
Yeah.
Can you talk about Broadway being one of the premier clinics over in North Minneapolis doing this kind of work? I think it's important for families to see that may not have had this exposure, but also for the scholars in the community to be able to see this happen day in and day out and learn the inner workings of what a medical facility really works like, but also how they can best plug in to being overall healthy in their very own communities.
Yeah, Broadway, so with the residents, they have to do a community rotation as part of their residency program. So they're out in the community, they're doing events, tabling events, they're doing health talks with different organizations. They've been like an appetite for change, teaching healthy eating and what healthy eating does for our well-being, whether it's our weight, whether it's controlling certain diseases that we may have, if it's genetics, genetic issues. I'm just talking about food and from growing it on our own and preparing it. And so they sit with Appetite for Change. They go into shelters. They do health talks about hygiene, about preventative care. So every first year resident gets a community rotation and a community tour. So we take them on tours throughout the north side, showing them different resources. If a patient is coming in saying that, they just went to 800 West Broadway and had went to the career force, our residents should know where that is. What our community members experiencing. So I like that we do have the residents. They run chat, health talks down at the U of M UROC Center down on Plymouth. We also have the ladder, and we're really proud of the ladder because it's our residents that are reaching out to the youth in the community who are interested in going into the medical field. So that it's free, it's open to the public, and our youth can come to the ladder at the UROC. So
I don't think people know enough about the ladder. I'm familiar with the program, and so I think it's a brilliant program that really gives that gives teens an integral look at what the ins and out of medicine can be like, and the future in medicine can be like for them. And then they're able to actually see people, like you said, the residents that are there at Broadway, figure out in real time, this is what it looks like. This is the person, and you get to see the matriculation of that experience. I think it's beautiful, and it gives them an opportunity to imagine themselves in medicine. Yep, I agree. I'm proud that we offer that program because it's needed, and the youth do come. They come and they're learning, and I'm excited about that. Now let's pivot a little bit and talk a little bit about the services as well as some of the programs. Now you talked to me a bit about some of the programs you guys have currently, but can you talk to me about some of the services that are being offered that may directly affect our community, our viewers at home right now, or may benefit them?
Yeah. So one that I love talking about is that we have Children's Dental come in on Mondays, one Monday a month, and they offer dental services. So we're a family practice clinic. There's usually not dental, but we offer dental the first Monday of every month. So we're proud of that. We also have social workers on hand. So if patients are in and they do have some social service needs, we do have social workers that can talk with them. Behavior health. So we have a psychologist who's there who does therapy and appointments there. Addiction Med, which is our MAT program. Medication assisted therapy. So we have a Suboxone program for patients who do struggle with substance abuse. So we have that, and naltrexone for alcohol. So we have those programs. But we also have a lot of community partnerships that we've created that also take up space in our clinic certain days of the week. So we work with Vail Place, which is a mental health organization, great resource for us. They have a housing group that they run every Friday from 2 to 4 p.m. out of our space. We have Twin Cities Orthopedic has done sports physicals, free sports physicals for kids going back to school out of our location as well. We've done, and we will continue. We've partnered with the Way to Grow organization, and we throw community baby showers every month out of our clinic. Oh, we've done backpack giveaways with St. Anne's, and they're going to do another bike giveaway with our organization out of our department, our clinic. So those type of programs, and being, seen, visible in the community, welcoming the community into our space to see what we're doing. We offer community tours, so we used to be at 1020 West Broadway down by
McDonald's,
McDonald's, in the Hawthorne Crossing.
Absolutely.
And when we moved up to the old CVS on 24th and Broadway, we got a grant for a community space. And so we built 1,000 square foot community space inside of our clinic, and we wanted our community to feel like they own this space, So I put together a community advisory board, and this is a group of 8 individuals that work or reside in our community that actually advise us on what kind of programming they would like to see in this space. So we meet quarterly, and so more programming to come. But
what has some of the feedback been from the advisory board about what they want to see? Because both locations that you shared, with anybody that has any familiarity with those locations or the landscape of the North Side, those are very prominent locations to be in. Residential areas with a lot of touchstone to the community, but also to a lot of places of worship and a lot of small businesses in the community. So what has been some of the feedback from the advisory board around programming?
I'm so glad you asked that question, because at first, when I put it together, I thought, we were going to, do, cooking classes, or we need a workout class, or we need, to, do, some type of class in this space. And so I went into it thinking that we were going to have all these type of classes. And it's funny because there is one member on the board who is Hmong, and he says, I think all this is good, but what we really need, I don't know if you know that North Minneapolis is home to the largest Hmong population here in Minnesota, and the church, St. Joseph Parish, is right across the parking lot from our church. From our clinic. And he says, we really could use a victims of torture support group in this community. And it was like, whoa, I didn't even think of this, but that is one of the most profound plans or ideas that our community advisory board had brought to the table. And so we're still working on that, the support group, because we need someone to lead it, and what does that look like. But that's why we have a community advisory board, because everyone can bring something to the table. If we want this, then do you know someone, and will you bring people in, and how. So that's one. Also just information stands, with these different groups. We have a member from Dakota OIC on the board, and he brought in a stand of all the resources that Dakota OIC offers. We also have someone from Turning Point who wants to start a resource library in our clinic regarding addiction and partner with our MAT program. So there's been some really good ideas coming from the community advisory board.
I think that's essential, like you said, to talk to people from the community about what they want to see reflected in their community.
Yeah.
And to hear, like you said, something so necessary. And like you said, they have such a large, the Hmong community has such a large footprint right here in the state of Minnesota. And so I want to stay tuned to hear more about that, as well as to see the impact of that assistance coming in real time to the community.
Absolutely.
Now, as you know, we are heading into the fall, which means plenty of our families in the community and across the greater metro area are heading for their kids to go back to school. What are some ways or some tips that you would like to recommend for our overall families to try and stay as healthy as possible from an overall standpoint, mentally, emotionally, physically, and for those practicing sexually.
Yeah. So my very first, and I hate to sound like this person, but I believe it. We all need primary care. We all need a relationship with a provider who knows us, who knows if something looks right, if it doesn't sound right, if this is normal, if this is not normal. So the first thing whenever I am given education or advice is get you a primary care physician. Like you said, with our youth going back to school, germs is gonna happen, but there's so many families without primary care that are in the emergency room all the time, going to the emergency room for issues that could have been solved with primary care. Just, if it's a strep test or a flu test or a COVID test, to flood the ERs or urgent cares to be screened for these when you actually could go to your primary care clinic is important to know, because so many of us use the emergency room as our primary care doctor. And so that is the first thing that when I am meeting a patient or someone out in the community, do you have a primary care doctor? Of course, wash your hands, carry hand sanitizer, informing your child, your youth that's about to be with all these other youth and germs, to just how to practice good hand hygiene. And then on top of everything, I am a firm believer in vaccinations. If you are not, to educate yourself, or to once again a primary care doctor, to get the good, the bad, so you're well informed if you do want to be vaccinated or not. It's just all about being well informed, but also trusting the person giving you the information. And it's really hard to trust someone you don't know. So get to know a primary care doctor.
I think when COVID happened, so many of us found out a lot more about people in our networks and their chosen ways to handle their medical care, right? So you found out friends that have primaries, people that don't, those of us, like you said, that may use the urgent care and or emergency room as our primaries, people who may have been receiving behavioral health treatments, things like that, or let's get grandma or grandpa into some type of care of some sort. And I know that for our youth, a lot of them focus on that level of health, or parents focus on that level of health during the fall because everybody's returning back to school. So we're getting, your physicals done and anything that you need for you to play sports. But we often forget ourselves.
Absolutely.
As parents, as siblings, as caregivers. And it's like, you have to take care of you so that you can take care of
others.
The younger, the younger people and the other people in your life that you love. So I'm grateful that you shared the different touchstones across the board for why it's essential for overall health as the school year begins.
Absolutely.
Now, we talked a little bit about COVID. Numbers are on the rise, and I hear that it is mutating yet again. So my question to you, Latrice, is how do we keep up with the information? And how do we tap into our primary care physicians or with our doctor's offices or our advocates or our care, our professionals, so that we're able to not only get the information, but sit with somebody and start to break down what we're hearing, because it's a lot. Primary
care, because most primary care clinics, and just over North Minneapolis, when I think of Fremont Clinic, Broadway Family Medicine, and North Point, it's wraparound services. You aren't just, just seeing your doctor. When you actually understand primary care, you understand that it's a full team of people that are helping you. So you have your primary care, you have a question about the vaccine, there's nurses that you can talk to, there's care coordinators you can talk to, there's your doctor you can talk to. But when the first thing, if you do have questions, make sure you ask them to the right people. And you call your clinic, I got questions. And who do I talk to? Websites, your community or your clinic organization's website, whether it's Facebook, Instagram, Twitter. Now is the time that they're about to start putting all the information about vaccines, because we're about to start pushing vaccines. So that information is going to start, being out there. There's all kinds of organizations that give information on it, but you got to be connected to these resources.
Absolutely.
You have to. And how do you? By other people getting the word out, utilizing community health workers, utilizing care coordinators, utilizing medical assistants, the front desk, the CSA staff. Everyone can spread the news. And it's just about wanting it, because it's out there. Yeah.
Talk to me about your personal connection to this work, because I can see that you not only have a passion for it, but you really enjoy doing this, not just talking to people, but making these connections and providing people with the information necessary. Yeah. What's the thing that gets you out of bed to keep doing this day after day?
I have to be honest. I am North Minneapolis, born and raised. I work in my community. I live right down the street from my clinic and that I work for. And these are my people. These are my people. It's my family. It's, mom, dad, sister, cousins, friends, family, friends of family. So when I see someone, I immediately want to help you become overall well. I'm not all the way well. Yeah, we all got things to work on to be overall well.
Right.
But that's exactly why I do, because I know I still got to get there, and I want to help our community get there. And so, I always tell the story that I was a medical assistant for 16 years before this. And that's being in the clinic, getting patients when they're sick or in need that day. And I knew that I wanted to work behind the scenes, preventative, or helping you to not need to be here or, in the hospital or the needs. And it's so easy to say, oh, you have diabetes. Oh, you need to lower your blood sugar. You have high cholesterol. You need to lower your HD or your LDL. You have high blood pressure. You need to lower, get it in this range and quit smoking. But who thinks of the barriers and what's going on in someone's life that makes that not a priority for them? It's like, okay, you want me to stop smoking, but do you know I have all these stressors? So, that's never going to happen. So who actually cares about that? And a doctor in a 20-minute visit, as much as they want to care, can't in a 20-minute visit. But there is someone that needs to actually get their hands on the community members that may understand more. And I knew I wanted to do that. And I definitely enjoy. I really enjoy doing it.
Well, thank you for the work that you do over not only in the community, but every day with your family to make sure that they are healthy, and then taking care of other people's family members to make sure that they're going back into homes and creating healthy spaces for those and for them. Now, for those of us interested in staying connected with Broadway, can you give us your social media handles, your address, the website, and any other information that we need to keep aware of what's going on?
Yeah. So our Facebook is UMN Family Physicians Community Health. That is our Facebook. And our Instagram is UMN Family Medicine. And those are the two social media handles. The address is 2426 West Broadway Avenue North. I'm in Minneapolis, 55411. If you need to call the clinic, our phone number is 612-302-8200.
That's wonderful. And then do you guys have any upcoming events or anything that we should know about that we can stop in specifically to support?
Oh, thank you. At this time, no, we're winding down right now. You know, the summer was really busy. Spring and summer was really busy. We have one more event at Open Streets on West Broadway on September 16th, but no other events happening in the clinic right now.
That's wonderful, and I hope that exists as another community partnership for you guys. We just had the executive director, Jose Zayas Caban, on here not too long ago. So a very special hello to the team over there at Our Streets, Minnesota. Okay, lastly, for anybody that is interested in stopping into the clinic but says, I'm nervous, I don't really like doctors, I don't really want to do it, can you just talk to them, looking at camera, and give them a word of encouragement about talking to a primary or speaking with a community health worker about their overall health?
Yes. So what I'll say is, I understand. I understand the journey of trusting medicine is a rough one. So if you do feel that you are scared or nervous or you don't know how to go about doing it, definitely ask for an advocate. Ask for someone that can actually hold your hand through the process. You do not have to commit to one doctor. You can date doctors. Date them. See if this is someone who you mesh well with. See if it's someone that shares your same principles. Well, not all your principles, because sometimes we don't have healthy principles, but yeah, date your doctor. See if this is someone you want to manage your care. Date the clinic. You don't have to stay at a clinic. You don't have to stay with one provider. What we all should care about is creating well people, a well community, and that doesn't have to happen with just one person, but it does have to start with us taking charge of our health and deciding to prevent any negative outcomes that we can. So yes, look around, internet research, walk into clinics. A lot of clinics are at community events, health fairs. So yeah, and if you would like any more information about it, I am always available. Again, Latrice Van Buren Thompson, and I'm available at 612-302-8227.
Thank you so much for joining me today, and thank you for the work that you do in the community, Latrice. I look forward to hearing about all the amazing things that come out of Broadway in the year to come.
Thank you. Thank you for having me.
Absolutely.
This was fun.
Unfortunately, that is all the time that we have for this episode of Community Connections. A very special thank you to Latrice Van Buren Thompson and her amazing team at Broadway Family Medicine Clinic. If you have heard something today that has tugged on your heart and encouraged you to take care of yourself and the scholars and the amazing people in your network, then I have done my job. As always, I am Anna Orr, and I look forward to connecting again with you soon.
Maqaan kiyya Dr. Elias Jama, pharmacistidha. So wannin dhaamsa qabu duraan dursee kan COVIDidha. COVID kana yoo namoonni shaatii hin fudhanne vaaksina yookaanis talaalee namoonni hin fudhanne akka fudhataniif ammallee COVID ni jira. So tanarratti waan dharaa miti waan dhugaati akka namuu COVID shaatii fudhatuuf hawwina. Yoo gaafii waa'ee COVID vaaksiinii kanaas yoo qabaatan nutti bilbila Sword Pharmacy yookaanis Access Clinic yookaanis Dooktara keessan bira godhaytan gaafachuus ni dandeessanii. Ammallee vaaksiiniin kennamaa jira, namoonni fudhatan akka fudhataniif isin gaafanna.